Hey everybody, it's Dr. Sam Robbins. Now today I'm going to talk about how high blood pressure is linked to hair loss and erectile problems. Of course, high blood pressure is linked to lots of health problems, but today I'll stick to the hair and erections. Now you'll discover the real cause of high blood pressure and how blood pressure drugs can cause hair loss and erectile problems. The two blood pressure drugs that can actually grow head hair and give harder erections, and natural ways to have healthy blood pressure. And this all starts from a subscriber question. And they ask, Dr. Sam, I have hypertension. I have had high blood pressure for a couple of years, and my doctor has now put me on medications for it. Unfortunately, I've noticed hair loss from it. I was already losing my hair, but ever since taking the drugs for hypertension, the hair loss has sped up. Oh, one other problem, my erections are very soft now. It's embarrassing. Should I get off the drugs? I like having my hair and good erections, but I also don't want to get a heart attack or stroke. Is there a connection, or am I just being paranoid? So yes, there is a connection and you're not being paranoid. And this is an interesting question for a variety of reasons. First of all, I have a family history of high blood pressure. So this has been a very important topic for me for over 20 years because of my parents. So I'll also give you the specific natural solution that I've given to my parents for the past 2 decades. Now, unfortunately, the older we get, the more blood pressure problems we have. And at the same time, the older we get, the more hair loss we have, and the worse the erections are for men as they get older as well. Now, the causes of high blood pressure are multifactorial, such as weaker kidney function due to aging, that causes high blood pressure, a higher chance of extra body fat and weight gain, which is more stress on the body and causes high blood pressure, higher cholesterol and blood sugar, which indirectly affect blood pressure, poor blood flow with plaque buildup, or weaker arteries, less pliable and flexible. And the biggest problem is hormonal imbalances as we age. Yep, high blood pressure is linked to hormonal imbalances and aging. So that's a major factor that sometimes we can't control. And since over 70% of adults have high blood pressure, this includes both men and women, and unfortunately, like less than 20% even know they have high blood pressure. Now, there's also dozens of different blood pressure drugs being prescribed these days, making big money for the pharmaceutical companies. Not only there are so many different drugs for blood pressure, there's also over a dozen different classes of blood pressure drugs, such as diuretics or beta blockers and ACE inhibitors and angiotensin 2 receptor blockers and calcium channel blockers and alpha blockers and alpha 2 receptor agonists, and then combined alpha and beta blockers and vasodilators and PDE5 inhibitors and so on and so forth. And all of these drugs have side effects, and one of them being hair loss and yes, also erectile problems. However, there are 2 exceptions. There's one specific hypertension drug that actually grows head hair, and there's also one class of drugs that lowers blood pressure and also improves erections. And I'll talk about both of these 2 drugs in a minute. So to answer your question, yes, blood pressure drugs can cause hair loss and more accurately speed up and accelerate hair loss. And yes, these drugs also cause erectile problems. Also in women, hypertension drugs can cause diffuse hair loss, which is thinning all around the top, but not necessarily receding hair loss like seen in men. So obviously these drugs are bad. Ironically, just having high blood pressure is also linked to hair loss in men and women. And there's actually a few clinical studies in humans showing this. And in fact, there's one study with over 610,000 participants and another with over 40,000 participants, all showing that between 30 to 45% linking hypertension to hair loss. And this could be because high blood pressure can damage your arteries, which means blood flow decreases. And also high blood pressure and poor blood flow negatively affect all your organs in your body, your brain, your heart, your kidneys, and yes, your hair follicles and penis. So before I continue and reveal natural ways of improving blood pressure without the use of blood pressure drugs, which can again accelerate hair loss and cause erectile problems, let's recap what we've learned so far. First of all, high blood pressure affects most people as they age. High blood pressure is linked to hair loss and erectile problems, and hypertension drugs have side effects, one of them being hair loss and the other being poor erections. So now comes that $1,000,000 question. What are you supposed to do if you have high blood pressure and you want to lower it to healthy levels, but you don't want to take drugs that have the side effects and can cause the hair loss and erectile problems? Basically, how can you have healthy blood pressure and reduce your risk for hair loss or impotence at the same time? Well, we can do it naturally or with drugs. Now, I'll do the drug method in a minute since there are a lot of precautions and potential problems, and most people will honestly not be able to access these two specific drugs. So let's first start with natural ways, which is obviously very important because a good diet and exercise program will make good improvements in blood pressure. And I'll give you links to other videos about the best diets and the best exercise programs for lowering blood pressure at the end of this video. Now, the problem with diet and exercise is that, first of all, it requires a lot of work and discipline and dedication. So most people will just not do it long term. And if you don't do it long term, you don't get the results. It also does not fix that underlying problems of hypertension due to aging and hormonal imbalances, basically what your body is lacking as it gets older. So this is why I also tell people to take specific supplements that promote healthy blood pressure levels by basically giving your body what it requires as it's getting older. Now, because the right ingredients do work, and there are a few that are clinical research. And the biggest reason is, again, taking supplements is that it's easier, it's faster, and more convenient. So most people will just take a pill, right? Rather than changing their entire lifestyle and diet and exercise program. This is what I had to deal with my own parents. And if you can just take a pill and you stick to it long-term, means long-term results and progress. So let me first give you a list of the best clinically researched ingredients for healthy blood pressure. Obviously, fish oil I recommend to everyone. There's also potassium and magnesium. Also specific herbal extracts such as hawthorn berry extract, olive leaf extract, celery seed extract, pomegranate extract, and also lycopene. Of course, I don't expect you to go purchase all of these individually. It's obviously a big hassle and it can get very expensive. This is why I dealt with this with my own parents over 20 years ago, and I have been having them take a supplement called Blood Pressure Optimizer for over 20 years. It has a 20-year proven track record, and it has the ingredients that I mentioned at the correct dosages and extracts. Plus, here's the best part. It's so effective that you're guaranteed results in 30 days, or you get a full refund plus an extra $100 cash back on top of it. That's how powerful it is. That's how effective it is. 20-year proven track record, guaranteed results in 30 days, or a full refund plus an extra $100 cash back. That's why my parents take it. Now, I put the direct link to Blood Pressure Optimizer below in the description area so you can give it a try and see for yourself. Now, moving on, let's finish off with the two drug options. First, the hair loss. Now, there is one hypertension drug that lowers blood pressure and grows head hair, and that's called Minoxidil. You've probably heard of the topical called Rogaine, which is the trademark name for Minoxidil, which now you can get just generic topical anywhere, right? It's used to grow head hair. However, what most people don't know is that the original oral pill containing Minoxidil was originally a blood pressure drug. And one of the side effects or side benefits was hair growth. In fact, it's very powerful at growing hair. Unfortunately, it grows hair on top of your head and everywhere else too. That means your face, your back, your shoulders, and so forth. Now, when the manufacturer of Minoxidil found out about this cool side effect or side benefit of hair growth, they made a topical version called Rogaine. They figured that if the Minoxidil is applied topically only to the scalp, then it will only grow hair on the scalp and not the rest of the body the way the oral pill does, which is partially true. However, you got to understand that anything that's topically applied, whether it's your scalp or your skin on your arm or whatever, does get absorbed systemically into your whole body. So topical Minoxidil will still cause facial hair growth And it's really more prominent and seen in women who use it since they naturally have no facial hair. But since men are already, somewhat hairy and so forth, the body hair growth isn't as dramatic with the topical and all that stuff. Now, let's talk about erections and hair loss. Now, I made an entire video about this, and I'll give you links to that at the end of this one. But a short summary is that the ingredient in Viagra, which is called sildenafil, is a PDE5 inhibitor. It works by increasing blood flow. It's a vasodilator. Now, it was originally made to improve blood pressure levels and still is under the trademark name of Revatio. However, one of the side effects or side benefits of sildenafil was erections. So the maker of the drug, Pfizer, rebranded and renamed the drug to Viagra and sold it for erectile dysfunction, basically has made billions. By the way, tadalafil, which is the ingredient found in Cialis, is also a PDE5 inhibitor like Viagra, which also helps lower blood pressure and is also obviously used for erections. So again, I've given you a lot of information, so let's do another quick summary recap. Poor blood pressure negatively affects your hair loss and erections. Minoxidil helps lower blood pressure and grow head hair. PDE5 inhibitors such as sildenafil and tadalafil, Viagra and Cialis, help lower blood pressure and improve erections. So at this point, you might be thinking, great, I'll just use both of these drugs and have a full head of hair and rock hard erections. Well, you could. Honestly, you could. However, the two combining these two drugs can potentially lower your blood pressure too much, and that's going to have side effects in and of itself. Plus, you don't know the exact interactions with both of these drugs together are going to have with each other. So that's also a big unknown. Also, before I go any further, I need to give you a legal disclaimer. Always speak to your doctor before you do anything. I'm not here to give you any medical advice. Okay, so now you have the two drug options, Minoxidil and a PDE5 inhibitor such as Viagra and Cialis, which you have to speak to a doctor about so you can get your prescription, which 99% of doctors, I'll tell you right now, will not give you the prescription for these drugs, certainly not both of them at the same time. And I guess you could order it online without a prescription. I totally get it. But again, mixing drugs can cause very negative health problems, short and for sure long-term, especially when these two drugs are kind of doing the same thing at the same time, different mechanisms. That's why I suggest you first start by improving your blood pressure with the right lifestyle, the diet, exercise, and natural supplements. It's the best long-term solution, all right? And even if you wanted to take the previously mentioned drugs, the Minoxidil and the Viagra and so forth, it's very important that you first make the natural improvement so these drugs actually work better and at a lower dose, giving you more positives and fewer negative side effects. So it's win-win-win-win all around. Since, again, my family has had a history of blood pressure, like I said, I suggest a diet and exercise. And for faster, easier results, take Blood Pressure Optimizer. I put the links to all these below in the description area. So please scroll down, take action, which is the most important thing, improve your blood pressure, and have a healthier hair and better erections and a happier and healthier, longer life. As always, leave your comments below, subscribe, like, and leave your comments about any questions you have, and I'll make additional videos for you. As always, thanks for watching. Thanks for listening. Wishing you a very happy and healthy day.